Morning. You guys all right to go? Thanks very much for joining us. There are 19,835 confirmed cases since the beginning of the pandemic. That is just 41 new cases since yesterday. There are, I'm sad to say, now 723 people who have died in Victoria because of this global pandemic. That's an increase of 7 since yesterday's report. 1 female and 1 male in their 70s, 1 female in their 80s, 4 females in their 90s. 6 of those 7 deaths are connected to aged care outbreaks. Again, we send our condolences and our sympathies to each and every one of those 7 families at what will be a very difficult time. There are 116 Victorians in hospital. That number continues to come down. 11 of those are in intensive care and 5 of those 11 are on a ventilator. A total of 2,488,773 test results have been received since the beginning of the year. That's an increase of 17,396 test results since yesterday. Can I again thank each and every one of those Victorians who came forward to get a test? And can I ask each and every Victorian who has even the mildest symptoms, please come forward and get tested. It's so important. It's a simple thing, but it makes a massive difference. In order to make really difficult decisions, finely balanced decisions about exactly how we deal with this enemy, how we have the best possible response, we have to have the clearest picture of how much virus is out there, where it is, how it's moving, trends and patterns. If you've got even the mildest of symptoms, as soon as those symptoms start, please come forward and get tested. We'll get your results back to you within 24 hours. 90% of those results are coming back within 24 hours, and you will have played an enormous part in our collective fight against this virus and our safe and steady steps towards a COVID normal and a normal Christmas and a summer like no other. It's such an important thing for you to do. In terms of cases of unknown source, 4,285, that's a decrease of 11 since yesterday. There are 176 healthcare workers who are active cases. We send them our best wishes and we thank them and all of their colleagues for the amazing job they do every hour of every day right across the state. There are 1,157 active cases in Victoria, so again those numbers continue to fall as well. In terms of the metro regional split, there are 52 cases in regional Victoria, active cases, in those local government areas that are under stage 3. No new cases in regional Victoria. There was a case reported from Horsham. I just want to take you through the details of that for the reassurance of people in the Horsham community and that district. The case reported was a person who's been in Melbourne for the past 4 months, is known to have acquired the virus in Melbourne and has not been in Horsham whilst infectious. The person's residential address is in that community, which is why the case has been recorded in that way. The case will have no impact on decisions informing when regional Victoria can take next steps, just for the avoidance of any doubt on that front. But those numbers in regional Victoria are low, they're getting lower, and that is, I hope, seen, well, it'll be very welcome in regional Victoria. I think we can be confident of that, but I hope that people in Melbourne are looking to what's occurring in regional Victoria as proof positive, not a model, not a theory, but the actual delivery of this plan. Our aim was always to get those numbers down, to keep them low, and then to be able to take those safe and steady steps. Today, I can announce that we have extended the state of emergency and the state of disaster for a further 4 weeks. That underpins all the different rules. It underpins taking those safe and steady steps, and of course I'll come to what those steps mean just to remind every Victorian about what those steps mean from midnight tonight. But regional Victoria will take one step today and they will potentially, around the middle of the week, reach those thresholds of less than 5 cases, a 14-day average. They're at 4.1 cases now per day. It's a mighty job, and I'm very proud of every regional Victorian, and every Melburnian should look with hope and positivity to what's happening in regional Victoria as not a theoretical exercise, not an academic exercise, but a real live exercise. This strategy is working. This strategy is delivering low numbers and keeping them low, and it's at that point that you can open with real confidence that having got the numbers low, you can keep the numbers low. You can open up and stay open. That's what we want, and that's what we will deliver. That is what we will deliver in regional Victoria and right across metropolitan Melbourne. Not bouncing in and out of lockdowns, but making sure that everything that Victorians have given counts for something and delivers us, as I've said, a summer that will be like no other. It will be a very different end of this year, and 2021 will be a very different year than 2020 has been. That's our aim, and that's exactly what we'll deliver with the amazing help and support of every single Victorian. In terms of my usual updates in relation to aged care, there are 572 active cases in aged care facilities. In disability facility settings, I didn't give you this number yesterday, we just double-checked and triple-checked, in fact. It is 10 active cases in disability facility settings, 6 staff and 4 residents. And again, both in aged care, we've seen some stability come to that and a fall in the number of active cases. In those disability settings where there's a significant underlying challenge, a real vulnerability with many of those clients and residents, that's very pleasing to see, not just stability, but to see those numbers fall consistently. I think that's all I need to do in relation to daily updates in terms of statistics. I just wanted to remind, as part of that the safe and steady steps, part of the roadmap, from 11:59 p.m. tonight, so essentially from midnight tonight, Melbourne moves from stage 4 restrictions to the first step of our roadmap, which brings small, I fully acknowledge, small changes that allow for more social interaction and more time outside. Social bubbles for those living alone or single parents, they will be allowed to have one other person in their home. Exercise is extended for 2 hours, split over a maximum of 2 sessions, but that goes obviously from 1 hour to 2 hours. And the notion of time outside, time outdoors, whilst at the moment it's just for exercise, it will also now be from midnight tonight for social interaction with one other person or members of your household. And of course, as we move towards the warmer months, the curfew is extended from 8 p.m, from tomorrow night, essentially from midnight tonight, so it'll apply from Monday night, from 8 p.m. to 9 p.m, so an extra hour of that freedom of movement. Playground and outdoor fitness equipment will reopen, and libraries will be able to open for contactless click and collect. We'll put all this detail up on the website, but we'd be grateful to you helping us get that message out there. They are small steps. That's what's safe. That's what is absolutely appropriate, with still numbers coming down, but too high to open up. I want to go now to regional Victoria. They move from stage 3 restrictions to the second step of the roadmap, which sees up to 5 people able to gather together in outdoor public spaces, a maximum of 2 households. Outdoor pools and playgrounds will reopen. There's some changes in terms of religious services, and as I've said, regional Victoria currently has a 14-day rolling average of some 4.1 cases. This is being very closely monitored, and it looks likely, but again we have to wait and see the next few days' numbers, but it looks likely that in just a few days' time, regional Victoria will be able to take another step, which has direct bearing in relation to pubs, restaurants, cafes. They may look a bit different. They may be much more outdoor rather than indoor, but those businesses will be able to reopen. Of course, we've already made announcements in relation to school, term 4 being pretty close to normal for regional Victoria, all year levels, all students, all schools. We'll have more to say about that quite soon, just the finer details of that. But regional Victoria have done an amazing job. We've just got to stay the course for these next few days, and of course once we start to open up in regional Victoria, that sense of vigilance that has made that possible, the contribution that's made that possible, will still need to be there. People coming forward and getting tested so we can manage any cases, any outbreaks. People keeping their distance, every single workplace, following the COVID safe plan. That ring of steel border, which we will put in place, and we'll have further announcements to make about that quite soon, where many more vehicles will be pulled up. And if you don't have lawful reason to be travelling into regional Victoria, you'll be turned around and you will be fined. All of those things, we'll have more to say about that, but I hope and I'm confident that every metropolitan Victorian, every metro Melbourne Victorian will look at what's occurring and what is about to occur in all likelihood in regional Victoria and see that for what it is. Proof positive that this is not a theoretical thing. It's real, the strategy's working, and we are delivering the safe and steady opening up that should give Victorians hope, that should see Victoria positive about beating this thing, opening and staying open. That's the key. That's what we're after, and that's what we will stubbornly deliver, because we have to. This virus is stubborn. It's not going to go away quickly, and it won't go away easily. We've got to do this properly, and that's exactly what we are doing. Now, I'm joined today by the Treasurer and the Minister for Industry, Support and Recovery to announce what is, without any shadow of a doubt, the biggest package of business support in the history of this state. And it needs to be unprecedented in nature, because the challenge that businesses large and small face is equally. We've never seen anything like this before. It is an unprecedented set of challenges that businesses face. We want to get to the other side, and we want to make sure that, yes, we've protected lives, but we've also protected livelihoods. We've done everything we can to make sure that businesses are there to rebound. This package of support, and I'll call upon the Treasurer in a moment to outline some of the details, and then Martin will speak about the relevant components for his portfolio. But this is a massive investment of both cash grants, deferred taxes, tax cuts. This is very, very significant, but it's what's needed. And I thank everyone from industry, large and small, diverse, right across the state, for the very productive partnership that we have with them, the direct feedback that's helped us design this package. It is unprecedented in nature. I can confirm for you that I will speak with the Prime Minister this Savo about that package to brief him on the details of it. And just as he had foreshadowed, not unreasonably, the federal government were very keen to see what we would do as a state government, how we would use the state budget to support household budgets, our balance sheet to support the balance sheet of businesses large and small. Today we provide that information. There will be further announcements tomorrow, and indeed in the days to come, to add to this package. But it is unprecedented because the challenge we face is unprecedented. No one is enjoying the reality we face, but none of us have the option of ignoring the reality that we face. We cannot open up now and stay open. It would not be safe. It would not be smart. I understand that businesses are desperate, not just for profits, but for their people. They are desperate to open up. But being open for a very short period of time is not the strategy. It is not the reward that Victorians are entitled to, given how much they've done, how much sacrifice they've made. All of that has to count for something. But in the meantime, we have to support those businesses to get to the other side. And that's why we've developed this package. It's why it's fully funded, and it's why it is, without any doubt, the biggest package of business support that this state has ever seen. I'll now throw to the Treasurer to take you through the details of the package from a taxation point of view, and then Marty can speak to some of the business grants.
Well, thanks, Premier. And we've said consistently that our intention is to be here every day, making the needs of the community and, of course, the needs of business our priority as we move towards not only dealing with the insidious impacts that the virus has upon community health, but also recognising that the restrictions that are in place are having a profound impact upon our economy. So for our state to recover, we need, of course, businesses to recover too. That's a key part of a strategy aimed to ensure, firstly, we fight the virus and we get it under control. And then, of course, the success is translated into something much more tangible in terms of the opportunities for growth as we come out of the restrictions and as our success starts to take hold. So as we take some more sustainable steps towards reopening, the support that we're putting in place will help make sure that we get through this together. And that's a key part of this. This is not essentially a process of one element of the community or one issue in the community constituting the priority over another. We know that we have to fight the virus first because we can't get the economy operating in an effective way without the confidence that the community has to be able to move in a COVID-safe way. So as we drive these numbers down and as we reach a new COVID normal, we're providing businesses with billions of dollars in support. This is the single biggest package of its kind in the history of the state of Victoria. We are able now to tell every Victorian that we are providing something like $6 billion in total. That's the long run of all the support we've provided in direct business support. That's more than any other state, any territory, and might I say, in terms of a percentage of our own source revenue compared to the Commonwealth, it also challenges, if it doesn't exceed, Commonwealth contributions. So this is a very profound package of support. It constitutes about $3 billion worth of support in this iteration, so it effectively doubles business support 1 and 2, which come in around about $3 billion, and of course slightly less than that, but with this package we're coming close to $6 billion worth of support. So to put that into some context, the $6 billion worth of support is the equivalent of about 25% of Victoria's annual tax revenue. So we know that Victorians have given up a lot. We know that there has been enormous sacrifices been made to drive the virus down, and we've asked them to not only keep safe but also to recognise that their collective effort helps us all. We secure a COVID-safe future by making these sacrifices, but recognising that government has to be there every step of the way to assist and support the business community, as well as, of course, recognising that the community at large is making enormous sacrifices that the strategy that the Premier's outlined is working. And I think the figures make it quite clear that that is the case. We know that business are hurting. They let us know, might I say, clearly and unambiguously. But we also know that there is no other strategy that will work. If we don't get on top of this virus, if we don't get to a position where the virus is manageable and we can get back to a COVID normal way of operating, we look around the world and we see the reinfection events, we see the profound impact that denying your circumstances have upon the operations of your economy, and it is clear there is no other way forward. The path that the Premier and the Chief Health Officer have outlined is the only way forward that we can go. So we've already provided more than $1.5 billion in tax relief and fee relief for Victorian businesses, and today we're going even further. So as part of that support, we're improving cash flow for struggling businesses to provide tax and fee relief. So there'll be $137 million worth of relief packages that include $27 million where we will waive liquor licensing fees for 2021. There'll be $41 million to bring forward a 50% stamp duty discount for commercial and industrial properties in all of regional Victoria. We will, of course, continue our efforts to make sure that Victorians get the support and assistance that they need going forward. And so far as the announcements are concerned, so far as the substantive business support packages are concerned, I will leave those to the Minister for Economic Support and Industry Recovery. But if you look at the numbers that we've got here, business community will receive something like $1.08 billion of cash grants. And the content of those cash grants I'll leave for the Minister to take people through. But we've got $33 million to provide for deferred increases in the landfill levy for 6 months. There'll be $30 million to waive 25% of the congestion levy this year with the outstanding balances deferred. There'll be $6 million to waive vacant residential and land tax for vacancies in 2020. And payroll tax for the full 2020-2021 financial year will be deferred for up to 12 months, so providing a vital $1.7 billion cash flow boost to businesses with payrolls up to $10 million. So up until now, Business Support Fund 1 and 2 have put in place some support for businesses with that rate around about $3 billion up to $3 million rather in terms of payroll tax obligations. What this does is it now provides some greater assistance, cash flow support for businesses under $10 million worth of payroll. Practically speaking, that is an enormous support for businesses, because what we hear consistently from business is their cash flow is their critical concern at the moment. Without revenue coming in, keeping their options open and their capacity to come back at the back end of this event in a stronger, more effective way will be in no small part due to their capacity to expend money and get their operations up and running as quickly as possible, and cash flow support is a key to that. So not only will there be substantial grant funds, as I say, $3 billion of combined effort in this package, bringing the total of business support to $6 billion. It's made up of a variety of things: cash grants, tax waivers, tax deferrals. All of that demonstrates that we're using every lever available to the government to help business make the necessary changes that will help them to run their businesses effectively going forward. I want to thank both Minister Pakula and Minister Pulford, but of course the Premier for his willingness to once again listen to the needs of business and to assure them that, as we said at the start of this, we're all in this together. And that means we'll all be making a contribution together to assure the vitality of our economy going forward. No greater demonstration of expenditure of priorities than that a government uses its own balance sheet to assist business and to assist the community through this. And I don't think you'll find a greater demonstration of commitment from any government across this nation. So to business, we understand the pain that you're feeling. And we believe that the strategy that we're putting in place, together with the support that we're putting in place, is about making sure that we assure ourselves not only of success in the short term, but of course of the demonstration that businesses will come back stronger and better, more robust, as a consequence of this event and the support that you've got from the government. Thank you. Marty. I think we go that way.
Thanks, Tim. I just want to reiterate one of Tim's points. This package that we're announcing today has come off the back of substantial dialogue with business across all sectors, and particularly over the last couple of weeks, very detailed conversations. And as Tim's indicated, we've already had well over 100,000 individual businesses have been supported through the first two rounds of the Business Support Fund. Those payments have totalled about $1.5 billion just from those programs. Business Support Fund 3 will provide in the vicinity of $820 million to another 78,000 businesses, and those businesses will be able to receive payments of $10,000, $15,000 or $20,000 depending on the size of their payroll, like the payroll tax waivers. That will be to businesses with payrolls as high as $10 million potentially eligible. That support is being targeted where it is most needed. That is, that businesses in sectors that will continue to be restricted or closed as we move towards a COVID normal, that's where the lion's share of support will go. So hospitality and retail, accommodation and tourism operators, hair and beauty services, repairs, maintenance, domestic cleaning, outdoor entertainment, passenger vehicles, etc. That crucial cash flow will be primarily targeted at those businesses which continue in the next stage to still be closed, heavily restricted or restricted. I know there's a great deal of interest in the question of sole traders. I would say to you that we are putting the finishing touches on some support for sole traders, which the Premier and the Small Business Minister, I'm sure, will have more to say about in the coming days. As I think people know, primary income support for many sole traders has been provided by the Commonwealth through JobKeeper and otherwise. We've been focusing our efforts on businesses that employ people, but the sole trader support that will be announced in the coming days is a recognition of the challenges that many sole traders have faced in covering overheads, and as I indicate, the Premier and Small Business Minister will have more to say about that in the next few days. The hospitality industry, I think, has been in many respects uniquely affected, other than a small window, I think, in June. They've been primarily not trading in a seated dining way. They are a vital part of our economy, and we are providing a dedicated fund, a dedicated licensed venue fund, which is worth $250 million, and will provide grants of between $10,000 and $30,000 for licensed venues across the state. That's pubs, clubs, hotels, bars, restaurants, reception centres. So in regional Victoria, eligible venues will be able to receive payments between $10,000 and $25,000. That's based on venue capacity. And in metropolitan Melbourne, that will be those relevant numbers will be from $15,000 to $30,000. The slightly higher amounts in metropolitan Melbourne, a recognition of the fact that it will take longer to get back to anything approximating normal trading than it will in regional Victoria, which, as the Premier's indicated, will hopefully move to another step in the coming days. We'll be looking to move swiftly on the Business Support Fund payments. We will be aiming to open the grant rounds this week via the Business Victoria website. And I'll just make a couple of other smaller announcements. We know how vital exports are to the economy and how important they will be to recovery. Exports are something like 12% of our gross state product. They support well over 300,000 Victoria jobs. So we're launching a $15.7 million export recovery package that's focused on the logistics and supply chain issues and connecting Victorian businesses to new markets through virtual trade missions. And there will also be a $20 million small business digital adaptation program, providing vouchers of up to $1,500 for small traders, micro businesses and small businesses, so that they can access off-the-shelf digital programs as well as training and workshops. So, look, as the Premier and Treasurer have indicated, this is a massive tranche of business support. We understand that primarily business is focused on the notion of getting back to trading, and as the Premier's indicated, driving these numbers down to the lowest possible level will be the key to that happening as soon as it possibly can. But in the meantime, this business support is about ensuring that we get as many businesses through this next few weeks, get as many of them ready to come through the other side to go back to trading, whether they be in retail, whether they be in hospitality or elsewhere, and to ensure that that they understand that the government support is something that they can rely on. So, with those few words, I'll hand back to the Premier.
I'm happy to take any and all questions you have.
Premier, how many businesses do you think will be able to get through this period now with this help that otherwise perhaps would have gone to the wall, and how many do you think will still potentially go to the wall?
Look, it's very difficult to make judgments about individual businesses, the position that they are in prior to the pandemic. Each business is obviously unique, but to the best of our ability, we've had a really detailed discussion with sectors, every sector really, about how we can support them. As Martin's just indicated, it's the best part of 80,000 businesses that will receive these grants. There are then not just cash grants, as important as that is. If you can't provide a business with customers because it's not safe to do that, then cash to survive, those survival payments rather than stimulus, is really important. But the time will come when stimulus is also very important, to look to try and have as many people employed as possible, to give in other industries that, whether it be construction or others, give them the certainty that there's a big order book of work, investing in skills. Some further announcements today, more than $50 million to upgrade every single TAFE college across the state. It does take many forms, and it is very challenging to try and predict exactly where individual businesses will finish up. But we acknowledge the pain. We understand how difficult it is. If I could flip this around and solve the economic challenge without solving the health challenge, well then of course you would do that. But that's just not the way this works. Until we get these numbers low, we have no realistic opportunity to keep them low, and what that means is we'll be open, but we won't be open for long. So that's to be avoided. But we do understand that's going to take some further time, and this package of support recognises that, and it will have more to say, particularly in relation to sole traders, and a package of considerable support very soon. And there'll also be some further announcements around how we try and help businesses to find that normal. We've talked a lot about outdoor drinking and dining. We've talked a lot about changing the way the city works. There'll be some imposts with that, so we'll have some more to say about those matters too.
Are you still expecting unemployment to hit 11% later this year?
Yeah, I don't think we've had cause to revise those numbers. I think that both the federal government, Federal Treasury I should say, and our Treasury that's broadly the range in which we think things settle. But the key point here is that those numbers will be only higher if we don't do this properly. We've got to get the place open, but we've got to keep it open, and that's how you can, with certainty, get people back to work, get businesses back profitable. And I think there's some coverage today about a number of regional tourism businesses who are looking at the warmer months, they're looking at the coming summer, and they're seeing that as a summer like we've never had before. It'll be pretty obvious, and from talking to First Minister colleagues in other states, the fact that there's no international travel has really been a great boost for local travel, for local tourism, for travelling within your state. So there is when you look to what's happening in regional Victoria, there's every reason to be confident, to be positive. When you look at this package and its size and scale and the targeted nature of it to those that really are doing it very, very tough because of these rules, I think this is exactly the response. But again, we don't rule out, come budget time next year, this is going to continue for a while, the notion that there's economic repair to be done. And we, of course, wouldn't rule out making further investments over and above the really substantial package we've announced today, Lundy.
Are you going to be funding this $3 billion in new spending announced today? Is that coming out of your new loan facility?
Well, there'll be a mixture, and the exact nature of where these things land will be reported in great detail. It'll all be brought to book once the budget is handed down, and next year's budget will do the same, because I think it is very important that every single Victorian, whether they're in business or whether they work for a business, we all have to accept the fact that this virus will be with us for a while. When we do this properly, as we are, and we get open and we can stay open, there'll still be economic issues we have to deal with, and it won't just be for one budget or 1 year or one package. It'll be for a considerable period of time. But I've tried to be as frank as I can with people. The Governor of the Reserve Bank's left us in no doubt that we've got to spend, we've got to invest. The Secretary of the Federal Treasury, similarly. The Prime Minister made some comments about this recently. We know and understand, I know and understand, that our job is to use the very, very strong budget position that we had coming into this 1 in 100 year event, a point that the Prime Minister has clearly acknowledged to me personally, that our budget was in a very, very strong position coming into this. We have to use the strength and the power of our budget, the state budget, to protect household budgets. That's what we have to do, and there's no greater contribution to the strength of a household budget than a job. And we'll have a lot to say in the coming weeks and months about tailored employment support, about getting people back to work, a partnership with employers, large and small. The point I'm making, Noel, is this is not going to be over from an economic repair point of view for quite some time. And that's why we'll have to stay the course on that too.
So businesses I've spoken to will no doubt welcome the cash injection, but what they desperately want to do is get open, and they're really worried about the under 5 cases scenario. And I know you're saying that regional Victoria gives us hope, but Melbourne seems a very different category. Is there any hope you can offer that maybe those October and November deadlines might be brought forward?
Well, what I can say is this. Every day we put the actual numbers, not the assumptions, not the theoretical modelling exercise. We put the actual numbers that have been delivered across Victoria into our thinking, into our projections. Models will get rerun and rerun again. That's the nature of modelling. Assumptions are always trumped by actuals. Data always beats modelling. It is our best estimate with very, very significant input. It's a very robust model, not one uni but two. Of course, there are many different views amongst modellers, and that's why they're very good at their job, because they have skills and opinions and views, and that's not an unhealthy thing. But as every day passes, as every week passes, that modelling will be updated, and it will benefit not just from assumptions, as robust as they are, but by what's actually happening. Now, I made the point yesterday, and the Chief Health Officer made a very similar point, that if the tail of this thing is more stubborn than the model predicts, well, then we will adjust our thinking. Actuals will always be part of this. It's not a theoretical exercise. It has to be in the very early planning, but then you update and inform, not as an academic exercise. It's live, it's real. This is not some trial, this is real. And we will continue to update, and we'll continue to work really hard to drive those numbers down. The key point, though, I think, is this. And I think every Victorian, despite their frustration and the fact they'd love to be under a different set of rules, love to be, skip forward to 2021 perhaps. But the key point here is this. If you don't get the numbers low in the first place, you've got no chance of keeping them low. If you open too early, you've got very little chance to no chance of staying open. So I understand that restaurateurs and others across the board, and they're perfectly entitled to have their views, but ultimately we can't flip it around. We can't deal with the economic challenge until we've dealt properly and in a sustainable way with the public health challenge. Get it low means you can keep it low. And that's exactly what we are doing. But all of those targets, all the data will inform that. And we'll have to see what's actually happening. Modelling is useful, but it never ever takes the place of what's actually happening. And that's why I know we're asking people to be patient, and I know it's very difficult to provide very, very detailed answers about what will happen in a week or 2 weeks or 5 or 6 weeks. But people were pretty keen to have a sense of dates and targets, and that's exactly what we've done. But they will be informed by what actually happens, and that's the only way that you can go.
So just to be clear, are you ruling out bringing that October 26, which for Melburnians is the most significant date? That's, the getting out of stay at home and getting out of curfew
Sure.
date and a reopening for a heap of businesses. Do you rule out bringing that forward?
I would say to you that it is highly unlikely that we will meet those case number thresholds. And because it's not just about numbers, it is also about the passage of time. We've had this discussion many times, but it's worth making the point again. One of the reasons, there are many, but one of the reasons why this is such a wicked enemy is that decisions I make today, I won't see the full impacts of that for 10 to 14 days, by which time it can be too late. You've got to do this not just safely, following advice, taking advice, but you've got to do it in a steady way. And the passage of time is, I know, very painful and very challenging for businesses and for families. But in terms of taking safe steps, it is a positive thing. You've got to let some time pass with a maintenance of testing so that you can have a clear picture, or the clearest picture possible, about what the impact of the decisions, the easing, the opening up that you've done is. If it were different, if every person could take a blood sugar test every morning and only those who tested positive stayed at home and everyone else could go about their business, then of course we would do that. That's not the fight we're in, though. So I think it unlikely. However, I just make the point again, this has never been just a theoretical exercise. You use the modelling to try and inform your decisions, but that is always updated, refreshed. It changes and evolves based on what's actually happening. But the principle remains the same, Rachel. You can't keep the numbers low until you first get the numbers low. I think everyone, despite their frustration, despite the fact they'd love to be open and serving hundreds of customers, I think people get that. Otherwise, you're not open for long. And I don't have any business. I have lots of feedback from business, and that's fine. This is a robust society, and we should have different views. There's nothing unhealthy with that. But I've not had, despite the pretty vocal criticism from many in the business community, I've had no business leader come to me and say the best outcome here is to open and then have to close again. That just doesn't make any sense.
Just on the modelling, my understanding is that the modelling was based on contact tracing, where 25% of positive cases were contacted on day one and 80% by day two. We've had much better contact tracing than that, thank goodness. I think it's well above 90%.
It is indeed.
Day one.
It is.
Best practice is 95%. Why are you using modelling that's basing contact tracing on such a poor...
Well, you have a situation where you put more than 1,000 different inputs into that modelling. and I can't give you a full list, I haven't got it in front of me of all those 1,000 inputs, but there's always upside and downside. There's always some things that might not pan out the way that you predict, and that is, they might not be as good. Weather, compliance with any rules you put in place, all those things. And then there are some things that might be even better. You might perform better when it comes to police enforcement of the rules, people staying the course and following the rules, contact tracing, whatever it might be, testing rates. Again, we've tried to be as realistic. There is some conservatism in this because the stakes are very high. And I know that there's probably people listening hearing me say that, and they say, yeah, and the stakes of staying closed are high too. I know that. I understand that. And if there was a different way of doing it, we would. If you could repair the economy before you controlled the virus, well, this would be a very different challenge. There are some countries in Europe at the moment that have made those choices, and some of them are reporting 10,000 cases a day. And who knows how long they'll be able to keep their current rules in place. I don't know. But those sort of numbers, with the mortality rate that we've seen, particularly coming into winter, we can tell people what it's like. Winter is no friend of this. It's really, really challenging. Now, who knows what they'll have to do? But if they do finish up in a situation where they've got to put rules back on, that's exactly what we're trying not to have to do.
Was some of the conservatism in that contact tracing modelling based on what was happening with contact tracing back in the early days of our second wave?
No, I'd say to you that we've had consistent improvement, very, very consistent improvement, and we now find ourselves in a situation, and not just for a few days, for quite a long period of time now. Otherwise, you wouldn't be seeing these numbers come down. That's the other point to make. I'm always happy to have a debate about these things, but you don't get a situation where you're reporting 30s and 40s if you're not delivering the sort of contact tracing that is absolutely essential to that. It's not the only tool, and it's not perfect. It is imperfect in many ways because, 100 people, 50 people, 250 people, close contacts, there's a lot of variability there. And trying to get 100% out of any task like that is really challenging. But in terms of contacted and interviewed within 24 hours, we are well into the 90s. And the only people we can't get to are people who physically we can't find, despite our best efforts, high tech and low tech. In terms of close contacts, we are at 99 point something percent, so all but 100, which is no small thing. And our outbreak management teams have never been stronger. And again, not since yesterday, for weeks and months.
So why base your model on 25% for the first day?
Well, Brett might be able to speak to that because I don't know that that's exactly what we have done. But Brett can speak to that.
Thanks, Premier. And I'm not sure the specific elements you're referring to, Rachel, but I think that 25% in the first 24 hours actually refers to assumptions about the symptomatic individuals who get tested within 24 hours of symptoms developing. So that's probably the reference that you're making, not about the contact tracing that's done. The inputs from contact tracing were the most contemporary we had. They referred to the week prior to that modelling being constructed, essentially, and those inputs going into place. So they were the most up-to-date contact tracing elements that would have been in the 90% ballpark for case contact and case interview, and 95+% for close contacts. But happy to chat to you afterwards.
What's the current proportion of new cases coming from known outbreaks and the number of mystery cases, I guess, given the numbers are getting lowish?
It's very strongly in favour of those that are known outbreaks and clusters and known positive cases. So it's something like 25-30% linked back to aged care outbreaks, 40% or thereabouts, it changes every day, that are close contacts of known cases. Another proportion, 10 or 15%, that are other outbreak settings, workplaces. And it's really only 10 or 20% that are unknown acquisition or, mystery cases. And so when you're down to 40 a day or fewer, that's really low single figures. So that's very good news.
The budding with aged care, why are we still seeing so many cases? I accept that we're not developing into those massive major outbreaks that we had, but why are we still seeing so many cases in aged care?
Very, very challenging setting to get on top of transmission. There are still household members of cases who are staff in aged care who are contracting it, because those staff are still being exposed, looking after aged care residents who are positive. With all of the PPE and with all of the training and awareness, it can still be very challenging to make absolutely sure that you don't get exposed. And, you know, they go home, they'll try and manage in terms of presenting for testing and isolation as soon as they're symptomatic, but there is that 48-hour period before symptoms develop when you're infectious. And so there are some household contacts of staff who are acquiring it. And of course, there are residents who can have some challenging behaviours or some wandering that is also hard to manage from an infection control point of view. And they're very infectious individuals. So again, with all of the PPE in the world, it can be quite a challenge to get on top of transmission within those settings.
So does that mean we'll just always have cases now in aged care?
No, I don't think so. I think we've seen a slow and steady decrease in the number of active cases in aged care. It's now, you know, almost below 500. It's always been at about 50% of our total active cases. So our total's now close to 1,000. Our aged care active cases now close to 500, but it was above 3,000, you know, a month plus ago. So it's also going in the right direction.
Sorry, documents tended to the inquiry have said that there's been a link found between the hotel quarantine and the aged care outbreaks. Can you talk us through that a little bit, or are you not?
Well, there's nothing new there. 99% of cases in Victoria are genetically linked to hotel quarantine. So to say that it's also linked to aged care outbreaks, yes, the overwhelming majority, if not all of them, will also be genetically linked to hotel quarantine. But in terms of an epidemiological link, I'm not aware of any that relate to the specific aged care outbreak that was referenced.
So there's no way to actually tell how many came specifically from the hotels that are now, I guess, deaths and those kind of things. Can we link those back?
So genetically they'll be linked back. The virus that was in hotel quarantine has been linked to the overwhelming majority of cases in Victoria, including those in aged care. But specifically and directly from the cases that were that arose out of the hotel quarantine, epidemiologically those links aren't there.
Was that the only link that has been found, the security guard and the aged care worker living together?
So I'm not even aware that there's an epidemiological link between a security guard and that aged care facility.
At what point do you need to go back to asymptomatic testing, given you're getting to the point where, based on what you've said, you know, we're getting less than 10 mystery cases a day? At what point do you need to start that, you know, broad asymptomatic testing of people just to get a feel for how much other virus is out there?
Yeah, look, there are always opportunities to expand asymptomatic testing, but as the Premier said yesterday, bang for buck is in close contacts, outbreak settings, and those settings where there's real outbreak potential. So the meatworks, the aged care facilities where everyone is tested, everyone is treated as a close contact, even if they're a casual contact. There are some high-risk industries where more routine surveillance through asymptomatic testing will occur. That still won't pick up much. I think the overwhelming benefit will be from really encouraging testing of anyone who's symptomatic. But we've got more testing capacity. The labs have done such a fantastic job in bringing the turnaround time down to under 24 hours that we've got that ability to ramp up testing of asymptomatic cases. And I think the high-risk industries, the industries that are going to open, are an opportunity to go there. But we have to balance where we know we'll get most utility out of testing.
Sorry, I was going to ask, do you know where the rolling 14-day average for Melbourne is at today?
I think it's at 56.9.
And are you confident we're going to get to 30 to 50 cases a day?
Yes.
Yeah?
Look, if you look at today's number, and they fluctuate a little bit every day, but we're looking at the 40 mark now. So if you project forward 14 days, you would expect that the 14-day rolling average to the end of September will be absolutely no more than 40 and is much more likely to be between 20 and 30, I would hope.
Why not publish that data on the website?
That data's on the website. The 14-day average is on the website.
On the front page with all the other daily
I don't know. I haven't seen the front page, but I'm pretty sure it's there on the landing page.
Oh, okay. All right.
We can direct you.
Would it be possible to
maybe put that in the daily tweet. I mean, that's the number that people most care about at the moment because it's, the number that will determine their freedom over the next few weeks.
Yeah, look, I'm very happy to go back to the comms team and make that part and parcel of the daily early update.
Can I just ask you about the singles change tonight? There's still... Sorry, I'm going to get back into that territory again. There's still some confusion about why a lack of consistency between people being able to go and visit their intimate partner, but then the rest of the family having to leave if they go and visit a friend. Is that likely to change? And also, do they still have to wear masks now as singles when they go and visit friends? Look,
it'll certainly change over time. As numbers go down, we move another step, that'll change. We'll have different settings. We've always flagged that. The intimate partner exemption, if you like, that's been in place for much longer was really a recognition of the importance of intimate partner relationships, and it's not to put aside the need for close contact for anyone who lives alone, anyone who's a single parent, and the weeks and weeks that people have been living alone without that contact. But it did apply to 500,000 plus individuals, 500,000 households, and so it's a significant additional contact. And even though we know that these are single individuals who are meeting up with another single individual, that's still a new contact for people who haven't been in contact. So overall, that's a not insignificant risk. We want to minimise the potential for transmission as much as possible. And so rather than say a single person go to a household, even though all of the members of that household are obviously in close contact with each other, they're all individually potentially meeting other people at workplaces, going out for food or other essential items or services. So there is the potential, a greater potential to bring in a virus into a household of a great number of people. So having a single individual go to, as a preference, go to the home of that person who lives alone or who's a single parent is the most conservative approach. And if someone is meeting that other individual in a bigger household, it's obviously the preference from a risk point of view to have just that one person meet. It's tough, and it's a constraint, and it does sit differently to the intimate partners. But we knew that the intimate partners were always close contacts. They had exposed each other if they had the virus, leading up to the restrictions that have been in place. So there was a recognition that you don't add a lot of risk by having them continue to be in close contact.
There seems to be growing concern among the health community that the continued shutdown in elective surgery can actually going to create delays for up to 2 years. Do you want to move on that pretty quickly, and how quickly do you see us?
Yeah, look, it's really for the Minister for Health to look into that, and there is an absolute recognition that there's a backlog and that there needs to be a significant blitz going ahead, but maybe the Premier can speak.
Alex, I've made the point a few times that obviously there are many thousands of Victorians whose surgery, particularly in the back end of Category 2 and Category 3, they've not been able to have their surgery. That is really challenging, really frustrating, really painful in a very real sense. When you've done as much elective surgery as this government has, more than any in the history of the state, they're not easy decisions to make. But in order to create capacity in our hospital system for those who needed time-critical, urgent COVID care, particularly those coming from aged care, there was really no choice. We will, quite soon, have more to say about a program. Again, that'll need to be steady and safe to recommence our elective surgery. I just would make the point, Category 1 has continued, as you would expect. They're the most urgent elective surgery patients and the most acute of Category 2. And of course, anybody whose clinical condition deteriorates or changes and would see them move into one of those categories, that's not a matter that the system deals with. Individual treating doctors would deal with that. And I'm sure there have been people that have been reclassified so that they could get their surgery because their circumstances have changed. There's no doubt, though, there'll be a big job of catch-up here, but we'll have more to say, not just about the resumption, but also about some targeted blitz funding and extra activity once it's safe for us to do that.
Yeah, we get on to some of the regional surgeries earlier, given what you said about them opening up.
Yeah, we're looking very closely at that. Given that, I think you'll see the regional Victoria's is now from 11:59 tonight, and certainly I think all things being equal, next couple of days pan out the way we hope, and they can be in a very different set of circumstances. They can take the 2 steps and you'll see that reflected not just in your ability to go to the pub, but there'll be school will be back. There'll also be lots of other services like surgery, for instance, that will be back on sooner and perhaps at a more at a faster pace. It might be resumed and get to normal quicker than it might well do in metropolitan Melbourne.
On hospitality venues, would you acknowledge that there might be some business owners watching who are thinking, if that November 23 date stands for having diners in my venue, a $10,000 to $30,000 cash grant is still not going to save me?
Well, I would hope that each of those businesses see this support as the direct result of feedback with them. It is a substantial amount of money, albeit I fully acknowledge that there's a lot of challenge there, for those businesses and many other businesses. The difficult thing here is that none of us can be certain about where we'll find ourselves in a couple of weeks' time or a month's time or 2 months' time. What we all have to do, though, is acknowledge that the principle that drives all this work, that is, get the numbers low so you've got a chance of keeping them low, that's the only option. We can go down we can do it the Spanish way, we can do it the French way, we can do it the way it is in the UK at the moment, where they're not getting hundreds of cases a day, they tragically, because we know what the mortality rates are, they're getting thousands of cases. And I don't know what they'll do about that, whether they'll have to change their rules, that's a matter for them. But I'm pretty sure I know what we'd be doing. If we were getting those sorts of numbers, then we'd have no choice but to put these rules back on again. So that's not the preferred outcome. That's not the way to do this. The way to do it is open when you are ready to do it, and it's safe to do that. When you've got the numbers low, then you can stay open, because you've got every chance of keeping already low numbers low for not just weeks, but for months, and indeed for maybe all of 2021, depending on whenever this vaccine gets here.
Is there an update yet on the Sydney convoy and contact tracing?
No, I've not received a report. I can give you, I've asked a couple of questions, and the answer back was that there was no bolt from the blue. There's no massive thing that they found that's going to change either their system or ours. And that kind of makes sense, because they've been in constant communication for months and months. But it's always worth double checking, triple checking. Some of the stuff we've had in industries, for instance, and I'm certain in some communications I've had with Gladys, I think they acknowledge that some of the work we've done with high risk industries, because we've had to, is perhaps instructive for them. It'll perhaps give them some insights that they wouldn't otherwise have. Of course, they'll hope not to have to need to use those insights, but all of us, I think, share information and we share effort, because the goal is a national one.
Would you be expecting, after your conversation with the Prime Minister, that there might be some movement on JobKeeper or JobSeeker this week from the federal government?
Look, Laura, all I can do is outline our plan. All I can do is outline the additional funding that we've put in place, because we've had that really important discussion with business, large and small, from every single sector. What the Commonwealth does is a matter for them, but I think every Victorian should take some comfort, I certainly do, in the consistent commentary from the Prime Minister to me, that hardship has always driven their policy response. And we're very grateful for JobKeeper, we're very grateful for JobSeeker. And as the Prime Minister indicated just only a few weeks ago, we're all Victorians. That's what the Prime Minister said, and I'm so grateful for that. I'm so grateful for that. But we'll wait. It's for them to announce what they're going to do with their budget, what they're going to do with their policy. But if hardship drives your policy, then obviously there's more hardship here than other parts of the country, and hopefully that'll be reflected.
You'll be talking to the PM this afternoon. Will you be advocating on behalf of Victorians for more federal support?
I always advocate on behalf of Victorians, but the exact nature of that advocacy is best done between the Prime Minister and I. I don't think it's particularly respectful to try and negotiate with the federal government from this podium, but I am very grateful to the Prime Minister for all the different things that he's doing, and no doubt he's very pleased to see these numbers coming down. That's, I know from very detailed discussions with other First Minister colleagues, whether it being Queensland, New South Wales, WA, Tassie, they're all very pleased. The Northern Territory, in fact, they're all pleased to see these numbers coming down, because that's good for all of us, not just for Victorians, but indeed for everybody across the nation.
Premier, there's more protests again today. after yesterday, they're finding new ways and new places. Is there a need to change the approach to this to deal with these people?
I think that, I'd leave it to Victoria Police to talk about the sort of tactics and strategy that they use to make sure that the law is enforced. I think police did a very good job yesterday, challenging set of circumstances. But, protesting is selfish, protesting is stupid, and protesting is dangerous. And if you do it, you will be dealt with. You will be fined. And I fully support Victoria Police and the approach they're taking. But as to any changes in that approach, again, I don't craft that. That's a matter for them. Victoria Police are doing an outstanding job.
Just to clarify, that's protesting on COVID.
Sorry?
That's protesting on COVID.
Well, yes, because we've got a state of disaster at the moment. And if you're protesting on COVID, or in fact anything, actually, when you think about it, I'm sorry, not to play word games, no protest, regardless of the cause, regardless of the thing you're for or against, is safe, responsible, and anything other than selfish at this time. That will, of course, change once we're in a different place and people without... So this is the thing. It's a peaceful and safe protest. No, it's not, because the virus spreads if there's too much movement. We'll get beyond that, though, and then people can, again, resume protesting about whatever cause they are interested in, provided, of course, they follow the rules.
Can I just clarify? Go too far, though, with the video pulling a woman out of a car fairly forcefully for having a mobile charger on her dashboard?
Well, I won't make any comments on an individual matter. That's a matter for Victoria Police, and I'm sure they'll be happy to speak to that issue. But I just make the point, no one is entitled, when pulled over, to not provide their name and to not provide their driver's licence. And all of that could well have been avoided if the person had simply, after the fourth time she was asked, given her name. Beyond that, though, I wouldn't want to comment on the specifics of that. The police can do that, because they'll have the full context to it and they'll know what might be the next steps, and I wouldn't want to cut across any of that. But, when I was asked to pull over just the other day, we were able to identify ourselves. The police, their badge was clearly shown. They were protecting every Victorian by pulling our car over. And when it became clear who we were, I didn't need to produce a licence, but if I had been asked, I would have done that, because that's what you do. Everyone's got a responsibility to make the job of police easier, not harder. They've had a tough year. They are doing an amazing job, and I fully support the work that they are doing. Beyond that, on that specific case, I'd leave it to them to speak to that.
Can I just clarify, on the business support package, given the different roadmaps for Melbourne and regional Victoria, is there a difference in the way it will apply to businesses in regional Victoria?
There is. So there's a recognition. Some of the grant amounts are higher in metropolitan Melbourne, because we know that venues will find that COVID normal later. Then hopefully regional Victorian venues can toward the end of this week. If we hit these triggers, if we just a few days away from taking not just one step but taking two. So it's tailored in recognition of that, but it's not like we're saying to a pub or a restaurant or whatever business it might be in regional Victoria, because you're more open than Melbourne, you don't get anything. They're still getting support in recognition that these last few weeks, and indeed the coming weeks, will be challenging because they're not completely open. But I think we've struck the right balance there. I don't expect that every person in business would necessarily see it that way. They, might well want more, but it's a significant package. It's a very significant package, and it tries to recognise and be guided by the different places that different industries are in and different parts of the state are in.
Will it apply to businesses that are essentially already folded?
You need to be a business that's up and running and going and got prospects, obviously. That's a difficult judgment to make, but there'll be other, I think, supports that can be provided to anybody who finds themselves in those sort of circumstances. This is tailored using the federal government job seeker and job keeper eligibility frameworks. That's the only way we can really go without making it so administratively complex that people have got to provide all sorts of information and documentation. We want it to be a simple process.
So effectively, if the business was receiving those but stopped receiving them as a result of closing down during this lockdown, they will not be eligible?
Let me come back to you with the exact details on what the threshold is, but we want it to be as simple as possible. And we do realise that there are many businesses that are kind of frozen at the moment, and with these support packages we'll be able to start up again once the rules change. So we've tried to be as tailored to those as possible. We'll have more to say. This may well be just as big an issue, maybe even more of an issue when it comes to some sole traders who've been very hard hit. Job Seeker will be the benchmark there, and that again speaks to the fact that there is actually a job there. There is actually a business that's still functioning or has the prospect of functioning on the other side. But today's not the day for them. We'll talk about that quite soon, because just doing that, some fine detail work, because it's a complex sector in that there are lots of different businesses and they're all in different circumstances. But we'll have more to say, and substantially more to say about them soon.
Just on the cash grants, when do you expect that money to actually hit bank accounts? Because we know that
as soon as we possibly can.
Is that days, weeks?
I think it's certainly in the next week or so we'll start to make payments. We'll make them as quickly as we possibly can. And I just want to make the point that whether it's Business Victoria website, call centres, we haven't doubled the staff. We've doubled them and doubled them again. There are literally hundreds and hundreds and hundreds of people there. And when last we did, so just in the aftermath, or early this week, so just after the roadmap was launched, we had many people wanting advice and assistance. At each point we have had more people providing that advice, and some of the call centre metrics have been, it's a credit to the hard work those people are doing. Very few people not being able to get through, calls being answered within seconds, not within minutes and longer. So we'll have from this afternoon and certainly into tomorrow, we'll have even more people answering phones, doing all of that work. So people can get the information and we can process this paperwork, which is at the minimum level, as fast as we possibly can. But I'm more than happy to try and update you as the week unfolds.
And when will they be able to just get forms and things like that?
I think all of it's on the website. If it's not on the website now, then it will be on the website very soon, and I'm more than happy to have Martin come back to you. Unless you want, I'm just saving the trip back on the stage, or I don't mind. But I think we will get the. In fact, I'm confident we will get these payments made as fast as we possibly can, and they'll be of great benefit.
The Federal Health Minister has said the digitisation of the contact tracing team will really benefit Victoria, and has asked for the modelling to be redone on the basis that the contact tracing team is going to be working better. Would you do that and release it?
Well, I think it gets hard to get better than 99.5%. And it gets hard to get beyond 92 or 93%.
He's talking about the modelling in terms of
Well, as I think Brett's just indicated to you, I perhaps didn't understand Rachel's question as best I should have before. I think the 25% number was in relation to exposure days, so the amount of people that we get to as quick as possible from the onset of symptoms, so how quickly they get tested, basically. In terms of the inputs into the modelling, that is our contact tracing performance, it's only a couple of weeks old, and we've been reporting into that national dashboard consistently, and we have consistently bettered 90% for interview within 24 hours. And again, I've explained a few times now, the only ones we don't get to are the people that with door knocks, repeated phone calls, we can't find. And there will be small numbers, very small numbers, but when you're chasing 100%, even one person is a big challenge. There will be, and there have been, people who have said, no, I don't want to be interviewed. We've convinced them 2-3 days later to do it, but this is a daily measure. It's a 24-hour measure. I haven't seen Minister Hunt's comments. I'm always happy to refer them to authorities, and they can be dealt with.
The borders as well.
Sure.
Sorry. South Australia indicated a couple of, probably 2 weeks ago now, that they would be more liberal on the exemptions for moving across the borders. Are we still in discussions with them in terms of getting more movement?
Let me get Minister Symes to come back to you on that. She's leading that. I would just make the point that the best thing any of us can do to get those borders open is to stay the course and drive these numbers down as low as possible. Once we get to that, that's when other states will be able to make judgments. And I'm not critical of what they've done. I know it's hard, but particularly those who live and work in those communities, and it's having an impact more broadly. But I don't begrudge them the very difficult decision that they've made. It's all about risk. And the way that we'll get those borders open and the freedom of movement that we're all fundamentally entitled to is when we get our case numbers down. And when Gladys or Stephen or Peter or whoever it might be can look at our numbers and know that we're not Spain with thousands of cases just waiting to happen. We've stayed the course, we've waited, we've opened when the numbers are low, and we've got good prospects of keeping them low. That's when they'll be able to make those finer judgments. I have also had a conversation, and I won't be completely definitive, because the Premier of New South Wales would always want to look at the next few days as they unfold, but I don't think that regional Victoria taking not one but two steps will see any of the easing of border restrictions taken off. I think that position will hold, because at least in my discussions with her, Gladys seems comfortable that those numbers in regional Victoria are low and they will stay low. They'd always reserve the right to review that, but best and only thing for us to do to get the borders open, drive down the case numbers and open in a safe and steady way. The moment they think that we're about to be France or the UK or Spain, well, then they won't be taking their borders off. They'll leave them there because they'll have no confidence that they'll make a judgment that we've opened up too early.
Just on property inspections, I've had numerous people who've sold houses and need to move, or their tenants who need to move, get in touch with me. No one's asking for, auctions to be reopened or anything. They just want private inspections with one person going through a house. That's now not able to happen until at least October the 26th.
That is true.
Are you thinking about reviewing that in certain circumstances?
Not that I can announce today, but I'm happy to have a look at it. There's a whole range of different issues that are being looked at in some detail, and we did make some announcements yesterday about pet grooming from an animal welfare point of view, beauty therapy, personal care, being aligned with hairdressing. That's been very, very warmly welcomed. In terms of auctions, I would just say if you've sold your house and you need to move...
I'm not talking about auctions, I'm just talking about inspections for people who need to move into
if
a
you
new
need
rental property or buy a property.
Yes, well, there
sold one.
are... Moving, you are exempt. You can move.
But you can't... No one's going to move into a house they haven't seen.
Indeed.
They need
well,
to
they
look
might.
at these places.
Well, the 2020 is a strange year. That might be going on actually. Like people are buying houses they haven't seen. Online auctions are still happening. Let's take that offline and see if there's some hardship provision or some special circumstance provision that we can use. We're not anything other than trying to be as fair as possible. But the auction point, and of course inspections being indoors by their very nature, is a higher risk activity. But auctions. Just to remind, you didn't ask about auctions, but to remind the audience, we've all been to auctions in our own street, had no intention of buying. We didn't register. The group wasn't 20. There might have been 20 registered, but the crowd's 50. We just got to be careful that we're not creating these environments where all you're really doing is almost inviting the virus to be spread from one person to another.
A quick question on behalf of young people. Playgrounds opening tomorrow. Are skate parks included in that?
No, they come later.
Can I just follow up on
a point of great contention in my household. Seriously, anyway. He's 13 years old and he's come to terms with the fact that he won't be skating at the skate park for a while.
Has he? You should go to a car park. Car parks are...
Well, you've got to be following the rules though. You can't be out for more than 1 hour, you see.
But can you go out in a car park and skate?
Well, if that's your physical exercise, I suppose it's no different to riding a bike, but you do that on your own or with no more than one other person. So again, all of us need to follow the rules regardless of whether we, I wouldn't be inviting pop-up skate parks. I don't think that's necessarily the best thing we can do. And if you did, it would be you and one other person for soon to be 2 hours. We're all making significant sacrifices, and that's why the numbers are coming down from 13-year-olds who aren't going to the skate park to people who don't have their businesses configured the way they'd like to. But we all know that the only way the numbers come down is if we stay the course on this.
Do you have any comments on the opposition's call for a Royal Commission into the state?
No, I have no comment about them.
Can I just ask on contact tracing again? We've spoken about it a bit today, but there was a proposal from local governments and the Burnett Institute to move those to localised hubs. This might be more of a question for Brett, but I just wanted to follow up and see where that proposal was at.
I made some announcements ahead of that call. We've been working for some time. As you know, we've got regional contact tracing teams, regional public health teams, and that's where, if you look at Barwon and the Colac outbreak, that we pulled up pretty quick, and thanks to everyone who was involved in that, not just staff, but all the people who went and got tested and have been really vigilant to pull that up at about 30 cases when it could have been so many more. It was done quickly. You look at the Latrobe Valley, where we were able to provide venues, dates, times, right down to the really narrative circumstances in which if you were at this particular venue at this time, come and get tested. Those regional teams are doing a great job because they've got that local knowledge. They know the local community that they're part of. We're doing the work now, and we will soon have more to say about the establishment of suburban public health teams. They'll be in partnership with public hospitals, but also local government. They've got some expertise as well from an environmental health officer point of view. They do all the food poisoning stuff, things of that nature. We just think having it, not so much to get the numbers low, but to keep them low, that local knowledge will really come to the fore.
Last question.
Have you set a date for the budget yet?
No, we'll have more to say about that soon.
And just back on the issue of a Royal Commission, we've had 726 Victorians die from this virus. All but 19 of those have died in the second wave, which has been linked to the breaches in hotel quarantine. Why not hold a Royal Commission?
Well, there's an inquiry on at the moment, and that inquiry will make recommendations and findings, and I think that our focus needs to be on getting to the other side of this, and all of us doing the very best we can to find this virus, to suppress it, and then to open in a safe and steady way and stay open. That's my focus. That's the focus of every member of the government. And I've got to say, that's the focus of the vast majority of Victorians who are doing the right thing, and I thank them. I'm very grateful, very, very grateful and very proud of regional Victorians who are so close to taking not one but two steps, to Melburnians who are staying the course on this and driving these numbers down, the 40s. It's only 5 weeks ago, 725 cases on a single day. We're not in that space anymore. This strategy is working. It will continue to work, but only if people stay the course and keep following the rules. Just again, if we can finish on this point, if you've got symptoms, even the mildest symptoms, please come forward and get tested as soon as you register those symptoms, as soon as the scratchy throat, the runny nose, the headache, the fever becomes apparent to you. Don't wait a day. Don't wait 2 days. Even if you're only at home, come forward and get tested. It makes a massive difference. Then stay at home till you get your result, and you'll get it. 90% of people are getting it within 24 hours. And then we can care for you, we can provide support for you, and we can make sure that you're not giving it to anybody else. That's the key. It's the absolute key. Please come forward and get tested as soon as you have even the most minor of symptoms. That's the key message. Are there any other matters? If not, thank you, and we'll see you tomorrow.